Well, thank you, everyone. Thanks for joining us this afternoon. My name is Angela Martin, and I work here at the Developmental Disabilities Institute at Wayne State University. The goal of our presentation today was really an opportunity for both staff and LEND trainees to get an opportunity to prepare for some opportunities upcoming in working with legislators to talk about how we can use our work and our learning from our projects, and then certainly from our academic learning, to share our knowledge with policymakers and legislators. So our goal today is hopefully to have that you get to leave today with some tools to then go out and either work collectively with colleagues here at the Institute or with others through the LEND project to go and to share information with legislators both at the state and the congressional levels as well. So first of all, we're going to start with some basics about how to plan, to arrange, to meet with legislators so that you can make plans for future efforts. So talking with elected officials is really, some people feel like, if I go and talk with so-and-so, they're not going to really listen to me. I'm an average citizen and can't really make a difference in a lot of people's lives in terms of policymakers. So what we do need to do is to recognize that. And I think over the last 6 months, we've been seeing how powerful local citizens can be in terms of really impacting policy change, or not policy change as it was most recently with healthcare, is that a lot of people coming together and making contact with their legislators, the congressional staff, has had huge impacts. This is a picture of one of our colleagues from Michigan Protection and Advocacy Service, who is working on employment and has been meeting with Representative Molinar, who serves the middle of the state, kind of like the M10 corridor, we say, and is relatively new to the U.S. Congress, but has been a state legislator for a long time. But what you know in working on disability issues and employment at the state level of funding versus the federal level of funding is different policy. So it's important to meet with legislators, even if they're long-term policymakers, their current position may have changed in which policies they need to be paying attention to. So taking each piece of legislation and meeting with legislators independently, it can be effective, particularly when you find out what their previous experience is. And it doesn't take a lot of effort. In fact, it's quite simple. One thing is the contact. The next thing is the follow-up and the relationship, which the contact is great. It's the relationship building over time is really where we want to be, both for your own personal advocacy and your own personal civic engagement, but also for our work at the Institute. A couple other resources. Every year the state legislator updates the Citizens Guide, and the Citizens Guide is a free resource that if you're going to your state website, your state rep or your state senator's website, it's probably posted there, but you can always go to this michiganlegislature.gov and download it. It's an updated resource. The important pieces of it really is, in our state government, they put all the information about committees and the calendars in there. It's all in one nice tidy thing, booklet. But if you don't need to print it out, you can certainly just use it on your website. But I do suggest that you update it. It usually takes several months for it to get printed because the new session comes in. So this one for 27-18 just got published in March. So we were working with the DD Council, our other statewide partner, a couple weeks ago, and the current documents weren't printed, which was really kind of frustrating because the council had planned all the meetings for that day, and the documents weren't there. So people were kind of flying by the seat of their pants trying to find out, where am I supposed to go? Who's my person? Where's the address? So it's a really helpful tool, and it's a free document, and you can call your state rep or state senator and get a paper copy, and they'll mail it to you for free. The other document on the right-hand side of the screen is Advocacy with Legislators, and this was really intended for people in the disability field in Michigan. This was developed, Michigan Partners for Freedom put this together in collaboration with the Michigan Developmental Disabilities Council, and it's at the council's website. We wrote it about 2 years ago, and it's written in ways just so people, all of you, folks that are new to working with legislators, have some perspective on working with policymakers and legislators from a disability perspective. So that's available for download as well. before I go on to voting, since you all are voted, if you didn't raise your hand or didn't acknowledge that you are ready to register to vote, it's really easy to find out if you are. You can go to michigan.gov/vote. That's essentially the Secretary of State's website. So if I did go to my wrong polling place, they couldn't turn me away. This is really important for folks with disabilities. Maybe they didn't know their polling place changed. They only have transportation to one site. They can still vote. And so when we work with folks with disabilities, we have to make sure that they know that. They don't have to go figure out a secondary transportation arrangement to then go and, you know, it's frustrating. It can be very frustrating. You simply have to give affidavit. And that's also the case when it comes to using the site. The other key piece of it is in Michigan, we have 2 polling machines that we use. In this country, some of you may or may not know, there's not a uniform polling system. So every state gets to choose their machine. And every state can choose to have 1 machine, 10 machines. They work it out. So the challenge being is that sometimes you don't know what the ballot's going to look like, and it's an intimidation factor sometimes for some folks. So if they can look online at the polling machine that they're going to use and the ballot before they go, we find that people are much more comfortable. And I think as all citizens, one thing a byproduct of that is that we all get shorter voting lines when we go to the polling stations because everyone's ready. A few other resources that we have within our network to help get you ready. So you voted for somebody, you know who your legislator is, now is talking with them. So it's the getting ready part before you go and meet with legislators. So DDI is part of the Association of University Centers on Disabilities, AUCD. And our network has produced a document about maybe 2 years ago to help folks who are working with, who want to connect with their policymakers to get a sense of how, how a bill's made at the congressional level. It does have policy or the committee structure in that document, but recognize that that has not been updated so that the contents of that is not up to date, but the other information is still very relevant and very current. And the upper right-hand corner is a picture of a friend and colleague by the name of Liz, who has Tuesdays with Liz, has done a weekly series on different disability policy issues. So you can go to YouTube, you can watch the new video. It's a real great resource, and it's always on current policy topics. So if something's coming up that you have interest in, it's very likely that Liz is doing an interview, and it can give you a good background by an expert in the field or somebody that's working on a legislation. And then the last piece is our network also has kind of an action center that kind of brings many things together. The one thing that I would point out is that the disability policy in brief, which you can all staff can sign up for to get delivered to your mailbox. So here's the key question. We kind of touched on this earlier. Some of you already know if you're a constituent or not, but really basic, civics lesson. A constituent means you live in the person's district. That person represents you. They're your representative. They're your elected representative for your district. And this has a lot of sway in a number of different ways. Number one, if you want to get an appointment with a legislator, if you say you're a constituent, you're going to get an appointment much quicker than I am. So this is Congressman Upton in this picture. And we were in D.C. a couple weeks ago, and Congressman Upton is the gentleman standing in front of the flags, and he serves Southwest Michigan, kind of the Benton Harbor, St. Joe's area. Almost, if you take your internal map of Michigan and kind of go from the state line all the way up to about halfway up the outside of your palm on your right-hand side, and you'd be up Lake in Michigan. So he's got a and he's served in the Congress a long time. So the gentleman that's on the congressman's left side is a gentleman right from Benton Harbor. And then the woman to his congressman's right is a colleague from the art community, and she has a chapter. Both her chapters are in his district. And the young man on the far right-hand side of this picture is one of our colleagues' sons, and he had never met with a congressman, so that was his 5th grade civics lesson. So it was great, because what happened in this meeting, and what was really interesting, is that we had started the meeting, and our colleague that lived in the district, the gentleman that you see in the picture, he had trouble finding a lift to get into the actual House office building. And so he came in late, it was a pretty straight meeting. Didn't have a lot of commitments, we didn't have a lot of progress, but one thing we did have is that we knew that this gentleman was coming in, because as soon as he rolled in and asked him where he lived, he said Benton Harbor, and his office was 2 blocks from Congressman Upton's actual office building, and that suddenly he took real interest into what he was saying. And that's all it took. We were saying the exact same things. We had data to support it, but if you live in the person's district and you vote, you will get listened to. It's really that simple. It really matters that you express when you are meeting with so-and-so on your district. I live in your district, okay? And so that they know that you know their district. Carries a lot of power and sway with a lot of legislators, as it should, because that's who they represent. We would hope that would. So you can meet with and share your ideas in a number of ways. Obviously, meeting is great. It's not always possible. And meeting with staff, I find, is really important. You build that relationship with staff, that's key. That's who you're going to be able to call and get a lot of action on a lot of items with. And you have to build that relationship over time. You can't be the person that's always calling for the ask. You have to be the give too. We're going to talk a little bit later about how we need to be more of the give and building those relationships. Calling is great. Writing an email is great. Faxing, I would pause and caution at mailing. Post 9/11, post anthrax, mailing a letter takes too long. They send it to an offsite, and some of you may or may not know this. They send it to an offsite center. It gets decontaminated, even if it's not contaminated, and then it finally comes. So legislation moves too quickly. It's best to use as many ways as you can. And now for some people that I don't use it, but social media is the other way. Things that we have to be kind of careful of in our roles, that we have to be careful about what we're putting out on social media, because we have a different responsibility. So here's my good friend Ryan Nicholas Gray shared this letter with me that he had written to Senator Stabenow, and it's a great letter. It's to the point. He shares a little bit about himself. He's a pretty, if any of you have met him, he's a pretty gregarious guy, and really, in very short sentences, tells it. He also included a picture with this letter. And then he sent it off to Senator. He did get a response from her, which he was really counting on. So it's important that that connection to start to get built. And he shares with why self-determination is important with him, why it's been such a key piece of his life and helped him to establish some relationship. This is a letter that I got back, an email thank you from Senator Stabenow. I had sent her a thank you for supporting an act. The UN Convention on the Rights of Citizens with Disabilities. This is from a couple years ago. Yeah. The other important thing is that we recognize when folks are supporting things that we're not asking of them, we're really just thanking them. And that is something that they need to hear. They need, particularly when there's controversial things, and they're sticking their neck out on a particular issue that is controversial, to say that, you know, we appreciate that. One thing we need to know is what a bill proposed to do and how it will affect. This is a picture of several of us that were in the Disability Policy Seminar a couple weeks ago and met with Senator Stabenow. The other thing the reason I show this picture is it shows not just DDI went and met with Senator Stabenow. Our partners come together. One thing that we can sometimes find in the disability community is that there's a lot of competing perspectives, and sometimes we don't sound very organized. And so when we can bring a lot of our organizations together on agreed, we might not agree on everything, but if there are issues that we can agree on and advocacy that we can agree on, then we should come together and collectively go and meet with our representative staff. So we want to make sure that Senator understands how particular individual issue will impact the individuals we know. And certainly why it's also important that we have folks with both personal and working perspective, because that personal story is what often is the clarifying notion. So there's several people in this group that had both a personal and a working perspective when talking with Senator Stabenow about several pieces of legislation. In this particular flow chart, we're sharing how mental health or behavioral health supports get funded in our state, and that's a federal program that's funded through Medicaid, and Michigan has decided to opt in. We have several Medicaid programs that operate mental health services, and those are administered by the Michigan Department of Health and Human Services. Currently, that program is operated by or delivered at the local level with 10 prepaid inpatient health plans, and some of those 10 PIHPs, as they're called, they're prepaid inpatient health plans. They're really administrative entities that then operate the services and deliver them at a local level. So we just, in that very short example, talked about both federal and state programs. And so sometimes it's hard to figure out where a program falls, but you have to know how it's funded, because that will tell you where it's up, where you take your advocacy to. So here are a few examples. At the federal level, a program like Social Security, that's federally operated. Okay, so people get Social Security funds that are delivered through a program. They might have state offices where you go to a local state office for Social Security, but it's still a federal program. Michigan's not, the state of Michigan's not involved in the Social Security program, and that it operates delivery. However, another program would be Medicaid, where that's a CMS program, Centers for Medicare and Medicaid Service. That's a federal program, but it's state operated because states are required to both match and facilitate, kind of like our mental health program earlier. Another example would be on the state side, where with that is that the Centers for Medicare and Medicaid Services provide for personal care. And in Michigan, we've decided our state program will be operated separately in a different department from our mental health program. So personal care, which we call in Michigan for that particular service, is home help. Home help is operated by a different arm of mental health. In other states, it's all on one program. So this is a great video, and I'm going to show it just briefly. It's a couple years old, but it really shows how a group of young people organize themselves. When you're meeting with a legislator, particularly if you're meeting with a group, it's really important that you organize yourself. Who's going to talk about what? Who's going to be the key person to bring up a particular issue?
There are 56 million Americans with disabilities in our country. Their future is America's future. Recently, President Obama sat down with young people with disabilities to discuss that future. Young people like student James Crane.
Hello, President Obama. It's such an honor to be speaking with you. Things that we've really been focusing on are unemployment in the disability community. The other one is accessibility, and we've talked a little bit about universal design. And then the third is education, making sure that people with disabilities are getting the education they need and not necessarily just being put into sheltered workshops, but being in integrated environments. Thank you so much for coming to talk to us today.
Student Rachel Manis.
I really want to thank you for making disability recruitment, disability hiring one of the priorities of your administration. It's amazing the progress that this administration has made over the past several years.
Director of the White House Domestic Policy Council, Cecilia Munoz.
My vision for the future of disability policy is that it should be something that every part of the government thinks about and integrates into its work. We're measuring the results of the executive order signed by the President on employment for people with disabilities. In total, in fiscal year 2011, the federal government hired 18,738 people with disabilities. That means we're very close to being on track to fulfill the President's promise of hiring 100,000 persons with disabilities in 5 years.
Senior Advisor to the President, Valerie Jarrett.
And we know that a better future will only come from comprehensive and informed policies that will positively impact the lives of people with disabilities. That's why President Obama will continue to invest in the education of children with disabilities, increased employment opportunities, better health care, and improved services that provide people with disabilities the opportunity to live and thrive in their own communities.
Student Allie Cannington.
I guess we've talked about so many of these issues, right? Education, employment, healthcare, what have you. But what I think needs to happen is a change of mindset, right? That disability is a part of the beauty of the diversity of this country.
You guys are great ambassadors and testimony to the power of a mindset that says everybody can, rather than everybody can't. I care deeply about this. I think we have made progress. I think we can make more. All of you had terrific suggestions. I'm going to tell you, I think maybe one of the most powerful suggestions was Zoe's point, which is self-advocacy.
Student Zoe Gross.
I'm autistic, and one of the issues that we're facing as advocates with developmental disabilities is that people often overlook us when they're trying to find allies in policy making. So I think really whenever disability issues are in consideration, whenever there's going to be a speech on disability, or someone is going to make a statement about a certain disability, or about the state of disability employment, or especially when new policies are being considered, to bring in people with disabilities ourselves.
What you need is people listening to you and making sure that every time we make decisions that have potential impact on your lives, that you're heard. But whether we're talking about education, we're talking about jobs, we're talking about housing, civil rights enforcement. My central goal is to make sure that everybody has the opportunity to maximize their talents.
Keep making your voices heard. Keep fighting for what's right. Keep demanding nothing short of equality for all. And the President and his administration will be fighting for you each and every day.
So, but the point of that is to show each person kind of had their particular key focus when they were talking. You only have, you're meeting with the President. Not all of us are going to get to do that in life. And whomever it is, legislators really have limited time. And so what's really important is that when you plan to meet with, this is Congressman Conyers, who's our most senior congressional member of our Michigan delegation, meeting with two folks, two local advocates with that are here in actually the lady standing in the back there with the green shirt on is Janie Vermillion, who is actually on our Community Advisory Council. So, and Andre is a former CAC member of our CAC. So you've got about 15-20 minutes. It's pretty typical appointments. You got to be really efficient. And when you're preparing and you're scheduling the appointment, they're going to usually ask who's coming, what do you want to talk about, what they're representing, where they're from. And those are pretty standard questions, so don't get thrown. Some people get thrown by that. And they also want to ask, which group are you representing? Because they do keep a log of who they've met with and try to give all groups opportunities to come and meet with them. The important thing is when you do schedule that meeting, then you ask who you're meeting with. But before you go, I would do a few things. Find out, make sure you know whatever legislation you're coming to talk about, make sure you know what the legislator's position is on the proposed bill or law that you're coming to talk to them about. It's important to know whether they support it or not. You feel kind of foolish. You say, hey, thanks for supporting it, only to find out that they have no plans of ever voting for any legislation that has to do with that particular issue. So you want to know what their position is. And if you don't know what their particular position is, you can ask. You can certainly, are you inclined to support this? You can ask where somebody's position. We're going to talk a little bit about where we have to follow. We have certain rules, as you said, staff, that we have to follow because we have federal requirements. We certainly can't lobby. And so we're going to talk to you a little bit about that. Lobbying is a no-no for a number of reasons as a nonprofit, but more so for also our legislative bill that created our entity, we have to be respectful for. The other thing is to visit the website and then join the listserv. Almost every legislative office, both at the state and the federal level, have email lists. It's really easy. Just sign yourself up and you'll get the information sent to you. So something that I have. Now, if you were born at a certain age, Schoolhouse Rock was something that you grew up on. I was born in the city, so some of you may think that this is not useful. It's still useful. So I encourage you, any of you, if you just need a refresher on how a bill becomes a law, go watch the video. I've been in DC large disability conferences and they still show this. It still has relevancy. And for those of you who have never heard of Schoolhouse Rock, it's really fun, okay? So go onto YouTube, look up Schoolhouse Rock and identify how a bill becomes a law. So in Michigan, just so you know how you know where a bill is falling, If a bill in Michigan if it's a Michigan legislation, if it starts in the Senate, it would start with the letters of SB and then the numbers. If it starts in the House, it starts with the letters HB and then the numbers. Now, if you go to Congress, a Senate bill, it starts with the letter S, and then it's an HR if it starts in the House of Representatives, if it's a congressional bill. So just so you know how to track things and find things, it's important to know that when you are contacting your legislator, that you contact them with this information. Don't just give them the name, because a lot of things come past by legislators. They need to know what bill you're talking about. Give the name as well, but know the number. The bill really makes the difference. The other thing I want you to know is you got to do a little bit of homework about the legislator. Find out a couple bullet points, prepare before you go about what you're going to say, and know you can bring pictures, you can bring videos to show kind of what a person's life would look like if something happens. So this is Kathy McMorris Rogers, and Kathy McMorris Rogers is she's now she's a Republican from the state of Washington, in the eastern part of East Central Washington state, so rural part of the state. She is unique for a couple things. She's a working mom, so she had 2 of her kids when she was running for Congress, and one of her children has Down syndrome. And so she comes with the parent perspective of both being a working mom who happens to have a child with a disability, and also is now in a leadership role within the Republican leadership of the House. So she was also a minority whip when we kind of whipped the votes together. So she's been a key leader, and she knows disability issues. She's been a big supporter of ours. So it's important to kind of know that disability perspective, because I've been in meetings with congressional staff or legislators, and somebody says, well, you don't really just understand disability, only to come find out later they had a personal connection. And we never would want to discredit somebody's personal experience. So it's really important that you do your homework before meeting with congressional staff or legislators to the best of your ability to find out if, in fact, they do know these issues and they do have some personal experience. The other important thing, and this is to Emily's point, you need to know where a bill lands. So you need to know how it's funded. That tells you where you have to put your advocacy, but then you have to know also what jurisdiction a particular bill falls under. So I'm going to just throw one out there and let's figure out where a bill falls. So where do you think Medicaid would fall? What committee in the Senate do you think would have jurisdiction over Medicaid? So you need to know those pieces of the puzzle that fit together so that you know where to put your energy, whether your senator might be really powerful in that particular committee and having some ability to negotiate before a bill hits the floor because it's gone to the committee level. So every page that you look at on the Senate, House, and the rep side, you can find who their jurisdiction is. Committees you need to go and look where the committee structure is. So prepare yourself. Let's say you're going to go meet with somebody and we're going to talk about Medicaid. I'd take all of these pieces with me if I was going to go talk about Medicaid. Even though the picture, the graph on the upper right-hand corner is talking about, and the green and light green bars is talking about employment, well, that still impacts Medicaid. Because if you have a job, you might not need Medicaid. But if you have a job, you might still need Medicaid. Sometimes you got to connect the dots for people. The other reason I would take these pieces of legislation, if I was talking about, and there's others you could use, is because they're nonpartisan. It's very important that we take nonpartisan information to meet with us, because we cannot lobby. We can do policy, we can do education, we can do advocacy, but we cannot do lobbying. And it also impacts what we can say. So these 3 pieces of material come from different groups. The one on the left with the question about Medicaid waiver services, that's from our colleagues at the University of Minnesota. That's actually an administration ACL funded project. The one in the upper right-hand corner with the green and light green bars is also an ACL project. It's the compendium that's produced every year. It's pretty well respected, the state of the state. And they do it every year, and it's every state, so you know how your state compares to other states, and then you can get a personalized profile of your state. So you could bring the Fed and the state information. It says for overall savings annually of all living expenses. So it's looking at the children one is $17,000, and then the amount that if the person was living in the family member's homes goes down. It's about a difference of about $4,500 savings. And then if they were living in any other setting, that would be outside settings, more restrictive or not with family in a facility. Essentially, it costs $51,000. So the same bar is right across for an adult. So it's about almost $20,000 in savings living on your own with family and then the segregated setting. So it's an important thing of why we use supports. And the advocacy here is not that we believe people should live with their families. It's not the advocacy here. The advocacy is that we know all other types have a higher quality of life and a better life, cost the system less resources, and can support more people, and we don't segregate people. That's the big point. Then the picture of the map in the lower right-hand corner of Kaiser Family Foundation, or Kaiser has been well regarded as a nonpartisan, independent assessor of Medicare and Medicaid reports. Both state legislators, congressional staff, they all use it. It's a great resource. It also shows that you can have when you meet with legislators, to let your state know where we are. So what's important in this map is that if you are a state in the blue, you adopted Medicaid expansion. If you are a state in the orange, you didn't adopt Medicaid expansion. And here in Michigan, we obviously have a project connected to that. The last couple of years, Julie has been doing a project educating families in Southwest about Medicaid expansion. So we could proverbially, essentially tie that information that we learned through that process and show how Michigan has continued to be in the better half. So there's more states, I know you can't see the numbers, but there's 32 states that adopted Medicaid expansion and 19 that include the territories that did not. So there's still states there. Now this was done in, I think, January. So this map could change fairly quickly over the next couple months. It's an important map to watch, and it's an important piece of advocacy. One thing in the state level, if you're looking at legislation as well, or when meeting with your legislators, one key piece that if you were meeting legislators right now in the state of Michigan, we would want to be focusing on is the 298 report. It's important to know what those pieces are so that you know when you're going to meet with them what are kind of the hot button issues and what's important. So DDI has, under our mandate from the act that created our entity, the Developmental Disabilities Assistance and Bill of Rights Act of 2000. That is the last time it was updated. In Section 101, Part B, subsection 3, it says that our role is to conduct research, which may include basic or applied research, evaluation, and analysis of public policy in areas that affect or could affect either positively or negatively individuals with disabilities and their families. So that's what we need to do in terms of our role, and how we do that role with using our information is we need to be available to advise policymakers if they ask for our information, our insight based on our research and work, provide training and technical assistance. That includes maybe doing some kind of public training to policymakers, which has happened in the past. Conduct research analysis of public policy is really important. A couple of years ago, the 3 Michigan partners, DD network partners, produced a report on employment. It was ours. That was a report that then helped to inform subsequent activities, including the Employment First project that came subsequent to that. The other thing is that we also can give knowledge to the field and make sure that when people are writing legislation, our data can be used as maybe basis, threat, a reason or rationale for a particular piece of legislation, both at the federal and state level. So here's something that I, last summer, was kind of a nice thing, is that our work in the Home and Community-Based Services Project was recognized by ACL and included in their remarks. So it shows that our work as being how we conduct research, what research we're doing is helping, being recognized by ACL as a model for other states. The Home and Community-Based Services is a federal piece of regulation, but is being managed by several departments, including oversight by the Administration on Community Living, who happens to also be our funder. So the difference between lobbying and educating, or advocacy or policy education, really key for us, because we're a nonprofit. We also have state rules. We also have federal rules that govern us. We cannot lobby. DDI staff cannot lobby. We can do policy education, and obviously we're required to do so. So the difference between lobbying, and here's a few examples. Lobbying is you're asking for somebody to vote for something, asking for them to take a position, make a change to policy legislation. Can't do that. That's lobbying. You actually have to have a different IRS code in order to be a lobbying entity. You have to register to be a lobbyist. That's not to say nonprofits can't have lobbying. They can. It's a different part of the IRS code, but they have to go through a long process of registering that part of their organization. The other thing is you're lobbying if you're showing only partisan information. We show nonpartisan. That's why I said it's really important that when we bring information, we're showing things that are nonpartisan, that are considered of quality, high quality research, and making certain that they're not a particular position. So we can share how a federal grant or a program has helped people we support, or said some results that we have from our projects. We can talk about the impacts of a particular policy, or what it might mean for somebody we support. Better yet, work with somebody who actually has a direct experience. Let them come and talk about it. You can talk about the program or impact at a research level. The other thing we can do, and invite people to come to programs and let them see what they're looking at. Let them see for themselves. You're basically the conduit. You connect them to the person that might have a direct experience or that personal connection. But the thing is you always have to say thank you, because it gives you an opportunity to be courteous and have that person remember you, but also to recap what you talked about. So it's really, the thank you serves a lot of additional follow-ups, and it's an opportunity for you to give something to that particular legislator. If it's some other piece of information, if they want more information, it really ties it together. So I mentioned the listservs. This is just last week's congressional connection. I'm on Congressman Levin, as I said, is my local rep. I live in his district, so I get this every week, and it's just an easy way to be connected and know what things are coming up. And I really encourage you to try and sign up for those pieces of quick email that can come to your box but give you a lot of information. The other possibility is that one day some of you may be given the opportunity to testify before Congress or the state legislator. This is Sarah Wolf, who was one of the key architects, advocates for the ABLE Act, which is now passed in Michigan. But her testimony in front of the Senate Health Committee was so incredibly powerful, and really was, as Senator Bob Casey said from Pennsylvania, one of the reasons he was able to work with his colleagues and get more people to see the value of the ABLE Act. ABLE Act stands for Achieving Better Life Experiences, ABLE, and provides 529 plans for people to save, which has always been a challenge for folks with disability, the inability to save. Michigan has adopted, that's a piece of federal legislation every state had to implement locally in their state, and so Michigan is one of the states that's kind of ahead of the curve and is able to do that. So I know we're close to time, if not already at time. Couple things just to remember. You can make a difference with meeting with that legislator. I mean, it really doesn't take a lot of effort. It can be a quick note. It can be a quick communication. The important thing is that you contact your legislator. Be connected. Make sure they understand what something can or can't do. Be prepared. Do your homework before. Don't kind of go in there on the fly and not kind of know where the person's positions are, or what issues they might have engaged in the past or supported in the past. And then certainly be organized.